Hi everyone, Latanya here with Healthcare Corner Talk. So this video is actually a special sort of request. My last/first event that I presented at, there was a few people in the audience that indicated that they wanted more information on finding dental services. Dental care is so important, and I know it is neglected by many people, but our oral health does result to how our overall health is as well. So I know in the state of Michigan there is major care gaps with that, but they're working on ways to change that. And recently there's been an expansion. Actually, April of 2023, the Medicaid expanded its dental benefits, where beneficiaries 21 and above is now eligible for dental services, as opposed at one time it was only children up to young adults 20 years old, and then those who had the Healthy Michigan plan, which included dental coverage, and there was a small cost sharing fee for that health plan. But people that had just straight Medicaid or straight Medicaid managed care plans, they did not have dental benefits, but there's still options for dental care. So I don't want people to think that because you don't have dental insurance, you're just um, at a loss. You're not. There is programs available, and in this video today, I'm going to show you how you can pretty much look that up. If you're not computer savvy, hopefully, you have maybe a grandchild or a child that can help you, or even going to your community library, someone in or community center can help you as well. So I am in the state of Michigan. So a lot of what I have to say will be tailored towards people in the state of Michigan, but there is a resource that I will show you that is nationwide. However, every state has a Health and Human Services department. So you should be able to go onto your state's Health and Human Services department to find certain resources, such as dental care and community centers and such. So for the state of Michigan, I found this landing page titled Free or Low Cost Care from a Dentist. You can find a public dentist, community dental clinic, community health center that offers dental care services, and then dental school. Now, I know a lot of people didn't know or may not know, but your local university school of dentistry in Michigan, or I should say in the metropolitan area, we have U of M School of Dentistry, and then University of Detroit Mercy School of Dentistry. These are dentist people that are in school for dentistry, and they have gone through, I'm pretty sure, a certain stage in their training where they are eligible to perform certain dental services. And this is at a very low cost as compared to you going to a commercial dentist office. So just a plug there that I want to mention. If you didn't know, now you know. You can also go to or contact your school of dentistry at your local university and see if they offer those services. So I'm just going to start scrolling here so you can see um, the different options. So here in the state of Michigan, we have community dental programs. We have the community centers, health centers, which are federally qualified health centers, FQHCs, and free clinics. So the free clinics and the community dental programs will be specific to Michigan, but the community health centers is that resource that I was sharing with you that you don't necessarily have to live in the state of Michigan to find one. So I'm just going to go through each of the links just to give a brief overview of what that looks like. So starting with the community dental programs, and I already have that pulled up. This is what the landing page looks like. It is part of the Michigan Dental Association. The web address is smilemichigan.com. And here you should be able to locate free and reduced free dental programs in Michigan. So I'm just going to briefly read the About section for the programs. So, known as free and reduced fee dental programs, community dental clinics treat low income individuals and families without dental insurance. They serve patients in need, including those on traditional Medicaid. So, this is traditional Medicaid is people that have straight Medicaid. That means they don't have a managed care plan. Managed care plans, some of them function as commercial plans, and they also offer Medicaid benefits similar to the Medicare Advantage plans. Again, we got Aetna, United Healthcare. They provide commercial products as well, and Medicare or Medicaid products. So, and then there's straight Medicaid, and this is directly through the state. There is no managed care plan managing the plan. So that's what they mean by traditional Medicaid. Throughout the state, these programs take the form of community care organizations, dental schools, and dental hygiene clinics. At these centers, dentists, dental hygienists, and other trained staff provide necessary dental care for patients who cannot otherwise afford it. Okay? Again, dental care is so important. So they really are trying to create robust measures to ensure people are able to receive dental care services. Um, so it has a drop down menu by county, or you can put in your zip code. I'm just going to put in my old zip code for demonstration. Okay, let's see what comes up here. So it changes to a totally different landing page. You can see the color schemes change slightly. And then you just scroll down, and here's the first one that popped up, general practice on Grand River. So you just keep scrolling, and now you just see, where you want to go. But that's how you would navigate that one. Now, I'm going to go back. So the community health centers, that is the FQHCs, the federally qualified centers. So they provide an array of services, and it's predominantly for people that are either underinsured, uninsured, also refugees, services, and definitely a great option for people that is in need of routine health care but cannot afford it. Rather, that's because they don't have insurance or they're underinsured. And when I say underinsured, it means their insurance don't really cover much, and they burden most of the cost anyways. So a lot of these centers, have low to no costs. Depending on what your income is, they assess that and determine if you are to pay anything, or if you do, it's probably like $10 or $20 for copay. But they are funded by the government. And then I'm just gonna bring up the website. So HRSA, they get the HRSA grants. That's how they stay afloat. So this is the landing page for HRSA. Now it looks a little different, I know, but I want to see if I can get that link to pull up. Yeah, it's Find a Health Center. I'll just make sure that I plug that in at the bottom of the post, because I want to make sure that you all have this, because this is national. This isn't specific to Michigan. And it could take you even further. So I'm just going to put in, let's see. 648-223. So we're going back to Detroit, and it's searching. And here are the healthcare centers. Now, key understanding is that you want to always call first. Make sure that they're accepting new patients. Make sure that they provide the services that you need. So not all health care centers or community health centers, FQACs, offer dental services. So you will want to make sure that you call, or if they have a operable website, you can go on their website. But even still, because we're just in a different age now where everything isn't just updated like it's supposed to, and you just want to call to make sure. So make sure you call and see if they have dental services. And even still, they can refer you to another location that does. So it's a resource and a resource, because these are people that work in the community. They are aware of different things that's available to people in the community. So if you go through a long list and say, you know what, none of these take, you feel free to ask. And sometimes, depending on who answers that phone, they will volunteer to share that information. Okay, so then lastly, I am going to go to the free clinic link. That was the third option on the State of Michigan website. And just going to click find a clinic. And this one is by county. So let's go with Oakland County. Where's my, oh, there they are. So if you scroll down here, these are the different free clinics that it's available in the Oakland County area. So I'm just going to click on Dr. Gary Bernstein Community Health Clinic. And they offer dental services. See? So medical, nursing, pharmacy services, dental services, community programs. Yeah. So this is slightly different than the HRSA link. This is specific to Michigan, but your state may have something similar, and they should have something similar where you can locate. So click, go Google. I know that's our best friend these days. Google free clinics in your state. You may be able to find something. It takes time to research and validate, but it's worth it. And if you have someone to help you, you make sure you ask for help. Don't be afraid to ask for help. Again, I'm here. Hopefully this video was of some help. If you are in need of some one-on-one services, please DM me to hear more how we can work that out. All righty. Thank you for tuning in. Take care.